Hello everyone, my name is Danielle Fazio and I am the HICAP coordinator at Jefferson County Office for the Aging. I'm here to talk with you about Original Medicare today. Original Medicare consists of Medicare Part A, hospital insurance, and Medicare Part B, medical insurance. When turning 65 and choosing to enroll in Medicare, you would receive Original Medicare and maintain it unless you chose a different Medicare option, such as a Medicare Advantage plan or another Medicare health plan. Original Medicare covers 80% of the costs of covered services, and you are responsible for 20%. With Original Medicare, you are able to see any provider that takes Medicare anywhere in the United States, and there is no limit to what you pay out of pocket each year. There are many factors to take into consideration when trying to figure out how much you will pay out of pocket for Original Medicare. Your out-of-pocket costs depend on whether you have both Medicare Parts A and or B, whether your doctor, provider, or supplier accepts assignment, the type of health care you need, and how often you need it. What is assignment? Assignment is when your doctor, provider, or supplier agrees to accept the Medicaid-approved amount as full payment for covered services. If your provider accepts assignment, then your out-of-pocket costs could be less. Providers accepting assignment also agree to charge only the Medicare deductible and coinsurance amount, and wait for Medicare to pay their share before asking for your share. If the provider does not accept assignment, the provider can charge more than the Medicare-approved amount for the covered service, which could be as much as 15% more. In New York State, the limit that can be charged for not accepting assignment is 5%. Now, let's talk about what each part of Original Medicare covers and the costs. Medicare Part A, hospital insurance, helps to cover inpatient hospital care, limited inpatient care in a skilled nursing facility. It does not include custodial care or long-term care. Part A also covers hospice care and home health care with a skilled nursing and therapy component. Most people do not pay a premium for Medicare Part A. As long as you have worked and paid Medicare taxes for 40 quarters or 10 years. For those who would need to purchase Medicare Part A and pay a premium, it depends on how long you worked and paid Medicare taxes. For people who have worked for 30 to 39 quarters, their premium would be $278 a month. For those who worked for less than 30 quarters, their premium would be $505 a month. If you choose not to purchase Medicare Part A, you still have the option to buy Medicare Part B. In most cases, if you choose to buy Medicare Part A, you must also have Medicare Part B and pay a premium for both Parts A and B. So although most people will not have to pay a premium for Medicare Part A, all people with Original Medicare will have to pay a deductible and coinsurance for Medicare Part A. When you are admitted as an inpatient in the hospital, you are responsible to pay a deductible of $1,632 for each benefit period. In addition, there is a coinsurance attached to your stay depending upon the amount of time you are inpatient within a benefit period. For days 1 through 60, there is no coinsurance each benefit period. Days 61 through 90, you are responsible for a $408 coinsurance per day each benefit period. Any days over 90, you are responsible for an $816 coinsurance per each lifetime reserve day, each benefit period. You are allowed up to 60 lifetime reserve days over your lifetime. For time beyond the lifetime reserve days, you are responsible for all the cost. So what is a benefit period? A benefit period begins the day you are admitted as an inpatient in the hospital. The benefit period ends when you have been out of the hospital for 60 days in a row. There is no limit to the number of benefit periods a person can have. Medicare Part B, medical coverage, helps to cover doctor services, outpatient care, home health care with a skilled nursing and therapy component, durable medical equipment, mental health services, and many preventative services. The standard premium for Medicare Part B is $174.70. The premium could be higher depending upon income. There could be an extra charge added to your premium called the Income-Related Monthly Adjustment Amount, or IRMA. Income-Related Monthly Adjustment Amount, or IRMA, is calculated by the findings from your modified adjusted gross amount reported on your tax return from 2 years ago. If this income is above a certain amount, you will pay the standard premium plus the IRMA amount. So, anyone whose modified adjusted gross from 2 years ago is above $103,000 single or $206,000 married filing jointly will be charged an additional IRMA amount. Here you will see the current IRMA chart that shows the various IRMA charges for 2024. In addition to the premium for Medicare Part B, you are responsible for a deductible as well as coinsurance. The deductible for Medicare Part B in 2024 is $240 a year. After the deductible is met, you are responsible for a coinsurance of 20% of the Medicare approved amount for covered services. That concludes our presentation for today on Original Medicare. We hope that it is helpful, and as always, if you have any questions or are in need of assistance, please reach out to us. Have a great day.